Welcome to the Golden State Media Concepts Sex Podcast, a show that examines all aspects of sexuality, from physical to emotional to spiritual. Join our hosts as they discuss age-old questions, common misconceptions, and the latest topics surrounding sex. They'll tackle topics about sexuality from the complicated to the hilarious and everything in between. GSMC Sex Podcast is your show for all of your questions about sex, even some you might not have thought of yet.
Thank you for listening to the GSMC Sex Podcast, brought to you by the GSMC Podcast Network. I'm your host, Gaelika Brown. If you like what you hear, be sure to subscribe to our show. And as always, let me break out into my little monologue. I am not a sex expert, but I love me some Dr. Ruto. However, I have spent some time on this earth and I've experienced some things and I have witnessed some things. And because I am an excellent listener that I am, I have heard some things. I'm a student of human behavior and I learn to love. I love to research topics and present what I have learned, which is what I do on this podcast. And of course, I'm going to give my 2 cents about the matter, but I will also include what experts have to say. Now, let's talk about sex. So this episode is strictly educational for me. I will not have my 2 cents to add on this topic because I have never been pregnant. The majority of the women in my life, like 98%, have been. And although I have heard that sex after pregnancy can be different, it never dawned on me that the women in my life were experiencing these differences. Overhearing them talk, I realized that there is a lot about a woman's body and pregnancy after sex that I don't know. So this is for all my mommy homies, and for those like myself who have no desire to be pregnant, here's a bit more incentive to keep that sperm away from your eggs, girl. So pelvicpainrehab.com has an article entitled Postpartum Sex, Your Pelvic Floor and Your Body. So here's what the article has to say. It is now the 6-week mark and you are at your postpartum checkup and are told by your doctor everything looks great and you can resume having sex. You finally hit this goal that everyone talks about, 6 weeks. But what does that really mean? Does it mean that everything down there is back to normal? Sex will now become a regular part of life again? If you are like most women who have just had a baby, sex is probably not the first thing on your mind. I have asked 2 women who have recently had their first baby about their experience at the 6-week mark. One is a friend of mine who demonstrates the typical, when she says typical, it's quote, typical, unquote, postpartum mom. Minimal complications, just normal changes that occur in your body after giving birth. The second interview is from a patient at PHRC who was willing to share her journey through recovery postpartum. Now, the article starts with the typical, again, quote unquote, postpartum mom. She asked them both the same set of questions. I will share some of the typical woman's response. She is 31 years old and 4.5 months postpartum. At your 6-week checkup with your MD, when were you cleared for intercourse? And what were some of the thoughts you had about regaining intercourse? Were you ready? Did you have any concerns? She says, yes, I was ready for intercourse. I didn't have a strong desire for intercourse, mainly because of the fatigue that comes with caring for a newborn. And it wasn't priority, but I didn't really have any concerns. When did you first resume sexual intercourse? Was there pain? Was there any dryness? Was it pleasant? I actually ended up having intercourse prior to my 6-week checkup, probably around 4 weeks. And I figured I was okay because I didn't have any injuries. There was no pain, but there was some dryness, which wasn't necessarily painful, but different than before. We just used lube. The question is, our bodies change after having a baby, especially our abdominal pelvic region. How has this, if at all, impacted your sex life or body image? Many women report feeling loose down there or lack of some sensation. How do you feel your body has changed postpartum, and is this a concern for your sex life? She says, nothing about my body image has changed or is affecting my sex life. The only physical symptoms I have is a small pinch that reminds me of some sciatic issues and affects my ability to stand, but nothing affects my body image or sex life. Now, the author goes on to say, now Cindy is quite lucky. This is probably a best case scenario, postpartum mom. While she demonstrates some things that her OBGYN could offer treatment for, which we will discuss below, generally her problems may resolve once she completely stops breastfeeding. Additionally, this pinch she feels is likely a pelvic floor issue that she could seek treatment for. But like most OBGYNs, they do not recognize this as an issue as it is not limiting her daily activities at this time. So this is the goal most women want: return to normal life after baby. The next interview is completely the opposite. This is a woman who struggled even before pregnancy. Yeah, there are going to be a lot of words in this episode that I will not know how to pronounce. I guess I can never play a doctor in a movie or a TV show. So I will spell out a lot of words like this one. Dyspareunia, Dyspareunia, which means painful intercourse. So this woman, before she struggled with this problem before she was pregnant, and her experience postpartum, considering her pelvic pain prior to pregnancy. Basically, she had this problem before, so her having a baby did not help. So this particular woman is 35 years old and 1.5 years postpartum. The question, what type of birth did you have and were there complications? She says, vaginal delivery. It was quick and easy labor. I only pushed for 30 minutes. I sustained a 2nd-degree tear and it went directly through the tissue that was already painful with sex. At your 6-week checkup with your doctor, when you were cleared for intercourse, what were some of the thoughts you had about resuming intercourse? I was thinking my doctor is nuts and there is no way there is anything touching me there for a long time. I was in so much pain still. Even sitting was hurting, sitting on the toilet or laying on my back. If I leaned to one side where my tear was, it felt like when you were sewing and the thread gets stuck and it's just pulling. Were you ready physically or emotionally? No. Physically, it wasn't going to happen, and I was so tired after giving birth and not sleeping through the night. Waking up every few hours to nurse, which I was also having issues with successful breastfeeding and was dealing with pain in my breast and down there. On a scale of 1 to 10, what was your desire? 0 to 1. How did your partner react? It was very hard. He was just not able to understand the pain and couldn't really relate. It was so new and different and so overwhelming. How did you approach dealing with all these issues since it was so overwhelming? I talked with my mom, someone who could relate to having a baby. I started to take walks with the baby to get out of the house despite the pain and get outside so I wasn't trapped in the house. I had a lot of anxiety regarding leaving the house and safety concerns, which I realize is normal for new moms. I then started going to a friends group and a mommy and me group, which helped a lot. I even hosted one and it made me feel I was a part of something. When seeking out medical advice, what did they suggest? Go back to PT, physical therapy. I was having painful intercourse prior to pregnancy, and when I was pregnant, I was told by my current PT at the time that there wasn't anything else they could have really done. I ended up doing a lot of my own research and went through 3 PTs before finding PHRC. When did you first resume sexual intercourse? What was your experience? 5 to 6 months postpartum. After seeking out pelvic floor PT for a few sessions, there was excruciating pain. It was disappointing because I thought I was further along with physical therapy than I was. Doctor's question, again, our bodies change after having a baby, especially our abdominopelvic region. How has this, if at all, impacted your sex life or body image? Many women report feeling loose down there or a lack of some sensation. How do you feel your body has changed postpartum? And is this a concern for your sex life? My stretch marks are really bad on my stomach and makes me feel less sexy in general. And I have loose skin. I feel generally thicker and was always very lean. I have started yoga to address this, but my body is different than I am used to. Emotionally, it is very draining to want to fix this issue. I have had to look at so many different options, and that kills the romance and passion. How did the PT treatments help even though you were not 100%? I no longer have any pain related to my scar. It was extremely painful, and even thinking about it I can still remember how excruciating it was. The vaginal entrance is no longer as tight or painful as it once was, and the vestibule burning is dramatically less than prior to therapy when I use my dilators or have sex. Is there anything else you would like to add? The 6-week mark is such a goal, she says, something to get to. At 6 weeks, I was not better. I still felt like shit. Again, I cannot relate. I can only imagine feeling like shit and then trying to have sex. But me imagining is nothing in comparison to experiencing it. But here's what the author has to say in response to her issues and the previous woman's issues as well. I like to discuss some of the common postpartum changes women go through and how seeking out PT may help with recovery in these areas. Many of these issues are demonstrated by one or both of the above women, and there are some other issues that neither woman described but are often a concern postpartum, which we will discuss below. Starting with dryness. Vaginal dryness occurs in the postpartum period because of a lack of estrogen while breastfeeding. It is our body's natural birth control to ensure that while you care for one infant, you will not be preparing for another in 9 months. Now, this is not a 100% sure way of preventing pregnancy, as there are cases of Irish twins. That was in quotes. But it still causes a lot of vaginal dryness with the lack of hormones. On a positive note, there are things that you can do to help the dryness. Many OB/GYNs can prescribe a topical estrogen cream that you can apply locally to the vaginal area that will help. There are also non-hormonal topicals women can try using, such as Vital V or coconut or emu oils. You'll also want to use a good lubricant. The site has some recommendations on lube in an article entitled Slippery When Wet. So here's a snippet from that article. What lube do you recommend for people with pelvic pain? Lubes that cause damage and irritation to the lining of the vagina or rectum can create pelvic pain or make existing pain worse. Pure coconut oil or aloe vera are the least irritating, but remember, oil cannot be used with condoms. Silicone-based lubes without the above listed preservatives would be my second choice for someone with pelvic pain and can be used with condoms. Of the water-based lubes tested, Good Clean Love, Slippery Stuff, and Sliquid Organic are the safest. For couples trying to conceive, I recommend Yes Baby Sperm Friendly Lubricant. For anal play, a lube should have a higher pH, so I would choose Yes But Anal Lube. Lastly, in order to avoid tissue damage and infection, everyone should steer clear of the ever-popular KY Jelly and Astroglide. Every person has different preferences of tolerances, so experiment a little to find out what works for you. If you are plagued by recurrent infections or chronic pain, it might be worthwhile, as Dr. Maggie Nays suggests, to take a break from all lubricant to see if it improves. And as the doctor suggests, not in regards to the lubricant, but we will take a break and discuss more of the issues addressed in the postpartum sex article.
Still on the search of that one true love? On the limbo in this crazy world of dating, marriage, relationships? Well, listen to the Golden State Media Concepts Relationship Podcast, your one-stop podcast for everything about relationships.
Welcome back to the GSMC Sex Podcast. I'm your host, Gaelika Brown. Now, we started to begin addressing issues that arise post-pregnancy, and we will wrap it up in this segment. Back to the postpartum sex article. Pain with intercourse can be caused by a number of reasons. One being birth trauma. Perineal tearing. I told you guys, I was going to be all kinds of stuff I ain't going to be able to pronounce. Epiostomies, Epiostomies, vaginal assistant deliveries such as vacuum assistance or forceps may cause trauma to the tissue and or muscles in the pelvic region. There may be scar tissue present that is restricting normal movement or that has become hypersensitive. Hormonal changes. Like we discussed above in the case of vaginal dryness, which can cause pain to the vestibule. This is the area of tissue around the opening of the vagina and the urethra that is hormone dependent. This means that a sudden shift in hormones, usually a lack of estrogen and or testosterone, causes this area to become painful, and most women describe pain upon initial penetration. Pain with insertion of tampons and or pain with vaginal exams. A previous history of oral contraceptives or acne treatments such as Accutane or use of spironolactone may predispose you to irritation of this tissue as well. Pelvic floor dysfunction, and that tight muscle may be the source of pain. As mentioned earlier in Cindy's case, the pinch and sciatic symptoms she is experiencing can be from a tight muscle in the pelvic floor or hip region, possibly the piriformis, piriformis, or orbitor internus, internus muscle, which can be affected during pregnancy and or childbirth. A pelvic floor physical therapist can thoroughly assist the pelvic floor muscles and the muscles surrounding the pelvic girdle and can help you to differentiate the cause of your pain and get you back to full function, pain-free. Body image issues, like Veronica's case. There are changes in the body such as stretch marks, weight gain, and scarring that can make a woman feel less than ideal when returning to intimacy. In part, PT can help with a safe return to exercise program to help shed some of the baby weight and return to a healthy postpartum body. We can also evaluate for a diastasis recti, diastasis, second word, RECTI, which is a split of the abdomen that commonly happens with pregnancy. Lack of desire. In both cases, both women reported that their desire was next to nothing, mostly because of baby fatigue. You have a new priority and are likely sleep deprived for quite some time, and that takes a lot of energy to care for a newborn. However, there may be more to it than that. Hormones can play a role. Body image issues, marital concerns, and pelvic pain all play a role. Pelvic organ prolapse, POP, occurs when the vagina and or uterus have dropped from their normal position in the pelvis. Prolapse can be caused by injuries sustained during childbirth, aging, chronic coughing, and or heavy lifting. This can cause a woman to feel abnormal pressure or a feeling of something falling out of the vagina. This may pose some concern with body image if it is visible, and it can affect how we function and perform our daily activities and can be a problem when trying to return to exercise. So what is the big deal behind this 6-week mark? Clearly, both women who I interviewed didn't really have a desire to go back into the bed. Though Cindy did, the desire was not quite there because of many other reasons. Typically, 6 weeks is when it is safe to return to sexual intercourse, and the risk of infection is minimal. Whether you return to intercourse is a personal decision between you and your partner, and there may be many factors that influence this decision. So the pelvic floor has been mentioned a few times, and I overheard some of my mommy friends talking about the pelvic floor and physical therapy for it. That's what prompted me to research this topic. The same site I found the previous 2 articles on, pelvicpainrehab.com, has an article entitled, "What is a good pelvic pain PT session like?" It first starts with an evaluation session that takes the full hour. They try to get as much info out of the patient so that when the patient returns for the PT session, they can get straight to it because time is valuable. Now let's get into the article. At the beginning of a typical PT session, we will walk into the room with the patient dressed. We question the patient for 2 minutes at the most. Just as on evaluation day, time is precious. We only have 1 hour, so we want to begin manual therapy on the patient as soon as possible. If we don't get to all of the info we need to in 2 minutes, then we'll just continue the conversation once we begin treatment. One bit of info we want to get from the patient is a description of their symptoms after their last treatment. We especially want to know how those first 2 or 3 days were after treatment. This is important for a few reasons. For one thing, oftentimes we'll focus on our treatment for the day based on what their response is and what is bothering them the most. For another thing, it allows us to educate our patient about responsible expectations. For instance, based on their response to the question, we'll explain why they were sore, if they were, or why their pain was better or worse. The first thing we'll do during treatment is to treat the patient's connective tissue. The reason we do the connective tissue manipulation first is that it makes it easier to treat underlying trigger points. It calms the nervous system down some. It increases blood flow to the area, and it relaxes the pelvic floor a bit. For the most part, there are 4 rungs to that ladder of pelvic pain treatment. They are working out external trigger points, working out internal trigger points, and lengthening tight muscles, connective tissue manipulation, and treating at structural abnormalities. However, the last, treating structural abnormalities, is only incorporated when it applies. Because I was going to say that was not for. They can't count, but that makes sense. All right. So, however, the last, treating structural abnormalities, is only incorporated when it applies. Okay. So during a typical appointment, we are focused on these strategies. Typically, we spend about half the appointment on connective tissue manipulation and external trigger point release, external work, and half the appointment on internal trigger point release and muscle lengthening, internal work. An appointment lasts for an hour, and patients either see us twice a week or once a week. So I found a blog on this very resourceful site about foam rolling for pelvic floor relief. They promote a specific brand. Here's what the blog says. The IntelliRoll, because of the groove built for spine and curves on each end that contour around the body. That's why they recommend it. The grooves improve the comfort of foam rolling and allow great access to tissue around the spine and tailbone, a huge bonus for our pelvic pain patients. While the pelvic floor muscles are generally the focal point of pelvic pain or dysfunction, they are usually not the only culprits. External muscle and fascia surrounding the pelvic girdle, including the Iliopsoas, Iliopsoas, adductors, quadriceps, iliotibial band, Iliotibial, gluteus, Gluteals, piriformis, and hamstrings commonly have a relationship to hip, buttock, back, groin, and thigh pain. Since foam rolling can directly reach these muscle groups, it is a very effective part of the home exercise program for those with pelvic pain or pelvic floor dysfunction. By reducing tightness and trigger points, improving flexibility, and increasing blood flow, a foam roller with minimized impairment from the big muscle groups. A foam roller will minimize impairments from the big muscle groups. Another benefit of the IntelliRoll is the ability to perform mobility exercise along the spine and tailbone, which improves posture and alignment to restore optimal muscle function. Now, there's a series of tutorial videos you can view on the pelvicrehab.com site. So let's take a break and return with working through painful penetration.
Tired of searching the vast jungle of podcasts? Now listen close and hear this out. There's a podcast network that covers just about everything that you've been searching. Hey! The Golden State Media Concepts Podcast Network is here. Nothing less than a podcast bliss with endless hours of podcast coverage. From news, sports, music, fashion, cooking, entertainment, fantasy, football, and so much more. So stop lurking around and go straight out to the Golden State Media Concepts Podcast Network. Guaranteed to fill that podcast itch. Whatever it may be. Visit us at www.gsmcpodcast.com. Follow us on Facebook and Twitter, and download us on iTunes, SoundCloud, and Google Play.
Welcome back to the GSMC Sex Podcast. I'm your host, Gaelika Brown. Now, the last episode I did on Betty Dotson's rock and roll orgasm technique, on her site, dotsonandross.com, Ross, the lawyer turned sex therapist, writes about her postpartum sex experience in an article entitled Working Through Painful Penetration. She says, "I've always been a size queen. Now that I can relate to. And I've always been able to penetrate my vagina with ease. When women would share their stories of pain during penetration and how it affected their lives, I couldn't relate until after I gave birth. I waited the 6 weeks before penetrating my vagina and decided to start with masturbation. It didn't seem right to saddle my husband with that sort of responsibility. I was more concerned about my C-section incision than the state of my vagina. Everything should be as I left it. I lubed up my favorite glass dildo and grabbed my Hitachi. As I started to insert my dildo, I felt a burning sensation. I took a deep breath and pushed out with my PC muscle. Nothing. It was like I was hitting a wall and couldn't penetrate myself. I was shocked, but undeterred. I tried again. Nothing. I couldn't get more than 1 inch inside my vagina. It was like all my muscles had clamped down and wouldn't relax. I racked my brain for a reason and finally accepted that my body was in a defensive posture after experiencing its first surgery. This was going to be work. The first thing I did was give up all orgasm expectations. Yes, I could have focused on my clit and rushed through a few orgasms, but I didn't want to push my body. I had to resynchronize my body and my mind connection. And the first thing I needed to do was appreciate what my body had been through. To give birth in your 40s is a different game altogether. And we made it through with flying colors. I'm always amazed at how strong I am and how my body is always there for me. I assumed a mindset of thankfulness and banished all negative thoughts about my tight vagina. When you're doing any sort of body modifications, like extreme piercings, they tell you to soak in a hot tub before stretching your skin. Right before any masturbation practice, I took a shower or bath to relax my muscles and warm up my skin. This really helped. As the water washed over my body, I touched my arms, thighs, all of me, and think positive thoughts. Then I'd put on my white terry robe. Okay, this part sounds a little weird to me, but hey. Like I said, I can't relate. And take Grayson, her son, out of his crib and head to our bedroom. Since he wasn't rolling yet, I'd lay him next to me on the bed, or sometimes he would be nursing. You can masturbate when you're a new mom, but the baby will be there with you. This may make you uncomfortable, but I can't think of anything more natural or healthy. I'm pumping endorphins into my breast milk and sharing sex positivity with my son. And let's face it, an orgasmic mom is a happy mom. Extra lubricant was super important. Generally, I lube my labia, clit, and vaginal opening before penetration of any kind. I used almond or avocado oil. This time I lubed up my entire dildo and used a lube shooter that I had no idea about. Okay, shoot that lube, girl, to get lube all the way up into my vaginal canal. Super lifesaver. Then I'd slowly penetrate my vagina, going as little as a half inch at a time. Taking a deep breath, pushing out with my PC muscle, penetrating that half inch, then stopping, releasing my PC and exhaling, bit by bit until I was all the way in. And I didn't use my usual dildo. I sized down to Betty's barbell, which was perfect. The band of muscles right at the opening hurt the most. Once I was past those, everything felt normal except my vaginal lining felt thinner, which is why lube was so important. I worked on breathing through the discomfort and focusing on good feelings. Sometimes I start with a few clit orgasms with my Hitachi. Sometimes I start with penetration and use the Hitachi at the same time to get past the painful part right at the opening. If you don't know what Hitachi is, check out the site, dobbsandross.com. They break down all that stuff. We kind of talked about it in the last episode. See, I listened to my body and took my time. And I didn't go right back to vaginal penetration with my husband. I performed oral sex on him and shared masturbation until I was ready. I think this is very important. When we have sex to satisfy our partner and we don't enjoy it, we create resentments that build and undermine our relationship. It kills the intimacy. I cared too much about my marriage to force myself to have penetration before my body was able to receive pleasure. And I communicated this to my partner. It was a process of slow penetration with no orgasm goal and body appreciation. For me, and I believe most women, it was a physical problem brought on by body trauma. It had nothing to do with my emotions or mental well-being. It wasn't all in my head. It was my body. Letting myself off the hook with respect to penetrative sex and shifting my mindset to acceptance and appreciation helped reintroduce my body to pleasure. But that was the only mental connection to the pain I experienced during penetration. Masturbation was work. I didn't feel aroused. I didn't want to orgasm. Slowly penetrating my vagina and adding clitoral stimulation to orgasm became my everyday regimen. I had to work through the pain until I felt discomfort, until I felt nothing, and then I felt pleasure. It took about 6 months before I got my vag back. I also had to work on resensitizing the area around my C-section scar. When I'm stimulating my clitoris, I'm most sensitive on top of my clit towards my pubic mound. I'd lost all feeling post-surgery. When I was healed and felt up to it, I'd run my lubricated fingers over my scar, and eventually I ran my Hitachi over the scar. It took almost 6 months, but slowly the feeling came back. I have a beautiful son, my vagina is back, my orgasms are stronger than ever. It took a lot of work, but anything that's worth it usually does. In the end, motherhood confirmed my commitment to pleasure. All right, so like I said, this is quite the educational journey for me. Hopefully it was for you, or that it was at least relatable. And I definitely appreciate your time. I thank you for listening to the GSMC Sex Podcast, brought to you by the GSMC Podcast Network. Until next time, I'm Gaelika Brown.
You've been listening to the Golden State Media Concepts Sex Podcast, part of the GSMC Podcast Network. You can find this show and others like it at www.gsmcpodcast.com. Download our podcasts on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type in GSMC to find all of our shows from the GSMC Podcast Network. From sex and relationships to health and wellness, life and happiness, and even weird news. You can also follow us on Twitter and Facebook. Thank you, and we hope you have enjoyed today's episode of the Golden State Media Concepts Sex Podcast.